Welcome back, everyone, to the 21st Century Man podcast.
It's great to be here.
We're diving into another fascinating chapter today.
We're looking at chapter 5.
Strengthening your heart.
Yeah.
And this one really, I think it's safe to say, it grabbed both of our attention.
It did, really, right out of the gate. It starts with a story
Yeah.
that I think really highlights, kind of the core message of this chapter.
Absolutely. So we're introduced to Dean,
Right.
who is 46 years old,
He was very healthy.
active, good weight, normal blood pressure, normal cholesterol,
Right.
Really the picture of health. And he dies suddenly
Playing hockey.
from a sudden heart attack.
Yeah,
This is why we're doing this deep dive, because we want to make sure that this does not happen to you.
absolutely.
And the book really, I think, does a great job of bringing these issues to light.
The chapter goes on to say that, during the autopsy, they found that he had a tremendous amount of plaque buildup
Yeah.
that was never detected during his life,
Right.
even though he was getting regular checkups and things like that.
And this goes back to, I think one of the most impactful quotes of this chapter.
I love this quote.
It says, "You are as young as your arteries."
Yes, and that kind of reminds me of that old saying, a man is as old as his arteries.
Yeah. It really makes you think, doesn't it?
It does. It really does. Because, we think about our outward appearance and, we try to eat right and exercise and all that. But what's going on inside?
Yeah.
With our arteries, these pipes, these muscular pipes that are delivering nutrients to every part of our body.
It is amazing. And the book points out, when you think about these arteries, if you were to lay end to end all the blood vessels in a single person, they could circle the earth twice.
It's amazing.
So we need to keep these things healthy.
Absolutely. And so that brings us to, I guess, what the chapter really focuses on is how to maintain healthy arteries. Right. And it all starts with this lining of the arteries called the endothelium.
Let's break this down. Endothelium.
Yes.
What is it? It's this single cell layer
That's right.
that lines every artery in your body.
Every single one.
Every single one.
Yeah.
And, it doesn't sound like much, but the book explains that if you were to stretch out the endothelium in a single person, it could cover up to 8 tennis courts.
Think about that. 8 tennis courts.
That is huge. So, it's one of the largest organs in the body.
It really is.
And we kind of go through life not even knowing it exists.
That's right.
So, and the discovery of the endothelium and understanding of its function were so significant
It was huge.
that they were awarded the Nobel Prize in Medicine in 1998.
That's right.
And the chapter talks about when the endothelium is healthy, it produces this crucial molecule called nitric oxide,
Right. And it's often abbreviated NO.
NO. So what does nitric oxide do?
It does a lot, but some of the main things that it does, it helps the arteries to relax and widen.
Okay.
And so when that happens, that improves blood flow throughout the body.
Okay, so better blood flow.
Better blood flow. And this can help maintain healthy blood pressure.
Got it.
And it also prevents the buildup of plaque
Oh, wow.
and blood clots in the arteries. And so we know those are things that we want to prevent because those are the things that lead to heart attacks and strokes.
Yeah. And I think this book really does a good job of explaining this process in an accessible way.
It does.
It really kind of makes sense.
It does.
And then, what I think is really interesting, and this kind of surprised me, is that the chapter talks about the connection between endothelial health and sexual health.
Absolutely.
Because I think a lot of men out there are experiencing ED and, maybe they're not thinking about the connection to their heart.
Right.
And the chapter explains that in order to achieve and maintain penile erections, you need healthy arteries and you need nitric oxide to be working properly.
To get that dilation.
To get the dilation, yeah. And so this leads to the idea of endothelial dysfunction, which we often abbreviate as ED.
ED.
And I think it's kind of a funny coincidence that ED stands for both erectile dysfunction and endothelial dysfunction.
It is. And I think it's really important for men to understand that, when you're talking about ED in terms of sexual health,
Yeah.
that can also be a sign of underlying problems
Right.
with your arteries. So it's really a vascular issue, not
Yeah.
just a, sexual problem.
So the chapter lays out this foundation, right?
Yes.
The importance of healthy arteries,
The endothelium.
the endothelium,
Yeah.
and the power of nitric oxide. And then it goes into how to maintain this vital system. And of course, as with almost all health issues, diet is a huge part of this.
It is, and it's a controllable factor. And the chapter opens up by saying that less than 2% of American men get enough fruits and vegetables daily, which is kind of a shocking statistic when you think about it.
It's pretty sad, really.
It is.
And I think this book is not afraid to kind of, point out those facts, those harsh realities.
Absolutely, absolutely.
And it goes on to talk about how the standard American diet, the SAD diet, which is high in processed foods, unhealthy fats, sugar, and salt.
Way too much sugar and salt.
It has a really negative effect on the endothelium.
Yeah.
On the other hand, the chapter talks about how a plant-powered diet rich in minerals, vitamins, and all these great nutrients that support endothelial health.
Yeah.
That is the way to go.
And it gives some really great advice.
Yeah.
It says, eat beets and beans, not beef.
Yeah.
Eat greens, not grease.
I love that.
And grab an apple, not a donut.
It's so simple.
It is.
But it's so memorable, and that's what you need, because it could be so overwhelming. And then the chapter goes back to, the connection between ED and aging arteries. And it uses this really interesting example from the Mayo Clinic.
I love this, yeah.
The Mayo Clinic found that men in their 40s
who
have ED,
yeah,
they have up to a 50-fold higher risk of future cardiovascular events.
Wow.
That's huge compared to men of the same age who don't have ED.
Yeah, that's a big difference.
That's a big difference.
It's a warning sign.
It's a warning sign.
If you're having problems in the bedroom, you may have problems with your heart.
And the chapter brings up this really interesting point about the fact that, we have routine screening for things like colon cancer.
Colonoscopies, mammograms.
Mammograms, yeah.
All these things.
All these things. Why not for damaged arteries in men?
I don't know. It seems like a missed opportunity to really get ahead of this problem.
And this is something this book advocates, right?
It does. It does.
It's like we're missing this huge, preventative measure.
Absolutely. And the chapter goes on to say that, cardiologists in general, they agree that men who have erectile dysfunction should have a cardiovascular evaluation.
Okay.
But it's not routinely recommended.
Interesting.
And the National Institutes of Health, the NIH, they have guidelines that suggest this.
So why is it not happening?
I don't know. I think that's a question we need to be asking.
Yeah, I think that's a really good point.
It just seems like there's this disconnect between what the science is saying and what's happening in the doctor's office.
Absolutely, yeah. And the chapter goes on to talk about this I thought this quote was really impactful too, from Dr. Paul Dudley White, who is a professor at Harvard Medical School.
Yes, I love this quote.
And he said, "A heart attack after age 80 is an act of God. Before age 80, it is a failure of medicine."
And I think what he's saying there is that we have the tools.
Yeah.
We have the knowledge.
Yeah.
To prevent heart attacks.
Yeah.
In people under the age of 80.
And this is why this book is so important, because it's bringing this knowledge to people.
That's right.
So having established, the importance of arterial health.
Right.
And, the real risks associated with silent heart disease.
Right.
The chapter goes into steps that we can take today.
Actionable steps.
Actionable steps. So the first one it talks about is the Coronary Artery Calcium Scan, or CCSS.
Yes, and this is a really important test.
Yeah.
The chapter describes it as being simple, quick. It only takes about a minute.
Wow.
It's non-invasive.
Okay.
It's a CT scan of the heart.
Okay.
And it uses a very low dose of radiation.
Okay.
And it's relatively inexpensive.
Okay. So tell us, what does the scan actually do? What is it looking for?
It's looking for calcium deposits in the arteries of the heart.
Okay.
And these calcium deposits are a sign of weakened arteries and an unhealthy endothelium.
So it's a sign that things are not going well.
Exactly.
Okay. And then how are the results interpreted?
So the ideal score is 0.
0.
That means you have young, healthy arteries, and you're at very low risk for a heart attack.
Okay.
Any elevation above 0 means that you have an increased risk.
So the higher the number, the greater the risk.
The greater the risk, exactly.
Okay.
And the chapter does note that if you've already been diagnosed with a heart condition, if you've had stents put in, you've had bypass surgery, you have known blockage, you've had a prior heart attack, you don't really need this test.
Got it.
But for everybody else, this is a really important test to have.
And I think the actionable takeaway here for our listeners is that they need to request this test from their doctor.
That's right.
Because it's not something that's routinely done.
It's not.
But it's something that can give you really valuable information about your heart health.
Absolutely. And then the second step that the chapter talks about is requesting advanced lab tests.
Okay.
And this is because those standard cholesterol panels that a lot of us get may not be enough.
They may be outdated. They may not give us the full picture.
So what are some of these advanced tests that we should be requesting?
Well, the first one is an advanced cholesterol panel.
Okay.
And this directly measures your LDL cholesterol.
Okay.
And it also assesses the number and size of LDL particles.
Okay.
So it's a much more detailed look at your cholesterol
than
just the standard cholesterol panel.
And this is important.
It gives you a better idea of your risk for heart disease.
Got it.
Then there's the hs-CRP test, which stands for high sensitivity C-reactive protein.
Okay, and what does that measure?
This measures inflammation in the body. And inflammation is a key indicator of aging arteries and damage to the endothelium.
So it's a sign that things are not going well.
Exactly.
And this test was actually patented by Harvard Medical School.
That's right.
Which is pretty cool.
It is. It is. And then it also talks about how high hs-CRP levels can be a predictor of future heart attacks, strokes, and even other serious conditions.
Cancer, dementia.
Wow.
It's a really important marker for overall health.
The next one is lipoprotein A.
Lipoprotein A, or LPA, as it's often called.
LPA.
And this is a genetic form of cholesterol. And about 25% of the population has elevated levels.
Wow.
So 1 in 4 people.
And if you have high levels of lipoprotein A, what does that mean for you?
It means you have a much higher risk of heart attack, stroke, and heart valve disease.
And the book talks about how this often runs in families.
It does.
So if you have a family history of these issues,
you should definitely get this test.
You should definitely get this test.
Absolutely.
Okay, the next one is homocysteine.
Homocysteine.
And this is an amino acid in your blood.
That's right.
And what does it do?
So when homocysteine levels are elevated, it can actually injure the walls of the artery. So it's not something you want to have high levels of.
So what causes elevated homocysteine levels?
Well, it can be caused by a few things. Sometimes it's due to a genetic variation like MTHFR, which affects how your body processes folate.
Okay.
But the good news is that if your homocysteine levels are high, you can lower them by taking B-complex vitamins.
So that's good.
So it's definitely a test worth getting because if you can identify it, you can treat it.
And then the last one is the ADMA level.
ADMA.
Okay.
Asymmetric dimethylarginine.
And what does that one measure?
This directly measures the health of your endothelium.
Okay.
So remember that lining of the arteries that we talked about?
Yeah.
So higher levels of ADMA mean lower production of nitric oxide.
Okay.
And more endothelial dysfunction.
And we talked about how that's connected to ED.
That's right.
So if you're having problems in the bedroom,
this is another test to ask for.
This is another test to ask for, yeah. And again, the actionable step here for our listeners is you need to ask your doctor.
Be proactive.
Be proactive, yeah.
Don't just assume that your doctor is going to order all these tests.
Right.
You need to ask for them specifically.
And if your doctor doesn't want to order them,
maybe it's time to find a new doctor.
Yeah, you need a doctor who's going to listen to you.
Absolutely.
And who's going to be proactive about your health.
Absolutely.
Okay, so the third critical step that the chapter talks about is what to do if you end up in the emergency room.
Yeah.
With symptoms like chest discomfort or you blacked out, you're having shortness of breath, or your heart is racing.
Yeah, these are all signs.
Signs that something's wrong.
Something's wrong, and you need to be evaluated.
So the advice here is don't leave the ER.
Without a complete evaluation.
Yeah.
Don't just let them send you home.
So the chapter recommends asking for serial cardiac enzymes.
Yes. And these are repeated blood tests that are done over a period of several hours to detect if there's any damage to your heart muscle.
Okay.
So they'll do a blood test when you first come in, and then they'll repeat it a couple more times just to see if there are any changes.
And sometimes that requires you to stay in the ER longer?
It may, but it's important.
It's important.
Because you want to make sure that you don't have any damage to your heart.
Absolutely.
And then the other thing you want to ask for is a repeat electrocardiogram, or EKG.
Okay.
And this should be compared to the initial EKG that was taken when you first came in.
Okay.
And this can reveal any changes in your heart's electrical activity that might not have been apparent on the first test.
Got it.
And then the last test that you want to ask for is a coronary CT angiogram.
Okay.
CCTA.
And what does this test show?
This is the most accurate way to see if your coronary arteries are clean and free of blockage.
Okay.
So it's the gold standard.
So the takeaway here for our listeners is don't be afraid to be your own advocate in the ER.
Ask for these tests.
Make sure you get the tests that you need.
That's right.
Before you leave.
Absolutely.
Now, this is something that I think is really encouraging.
It is encouraging.
The chapter talks about how the old view of arterial aging, which was this linear progression.
Right.
Like You get older, your arteries get worse. There's nothing you can do about it.
Like a one-way street, just going downhill.
That view is being challenged by modern science.
Absolutely.
So that's good news.
That is good news.
So reversing arterial aging is possible. And the chapter goes into some different interventions.
Right.
And I think this is really interesting because it goes beyond just lifestyle.
It does. It talks about things like medications,
Yeah.
supplements, things like that.
So the first thing it talks about is statin cholesterol medication.
Yeah, and it mentions a study of over 13,000 patients that found that statins were associated with a lower risk of adverse outcomes in patients who had a coronary artery calcium score above 100.
Okay.
But, and this is a really important point,
Yeah.
patients with a CACS score below 100
Yeah.
rarely needed statins.
So again, knowing your CACS score is really helpful in guiding these decisions.
Absolutely.
Then it talks about plant-based nutrition. It highlights the work of Dr. Dean Ornish.
Back in the 1990s, he was a real pioneer in this area.
Yeah.
And he showed that it is possible to reverse the progression of blocked arteries through a plant-based diet
Okay.
that was very low in fat, combined with walking, social support, and stress management techniques.
And he actually was able to show reductions in artery narrowing. Measurable reductions, yeah.
And his program was so effective that Medicare actually started reimbursing for it in 2010.
Wow, that's huge.
It's a big deal. It shows that the medical establishment is starting to recognize the power of lifestyle changes.
Absolutely.
And the Pritikin Longevity Center program also received the same Medicare designation.
Wow.
So it's really encouraging to see that.
It is. So what else does the chapter talk about in terms of interventions?
Well, it gives a special mention to aged garlic.
Cool.
So garlic in general is good for you.
Right.
It helps with blood pressure, cholesterol, clotting.
Yeah.
But aged garlic extract has actually been shown to halt the progression of heart disease and even reduce plaque in the heart arteries.
Wow. And are there any studies to back that up?
There are. The chapter mentions a 2016 study that used CT angiograms to show that aged garlic extract can reduce plaque.
That's amazing.
It is.
And then it also talks about how onions.
Yeah. They're a good source of sulfur compounds, which are important for antioxidants.
Okay.
So they complement the cardiovascular benefits of garlic.
So garlic and onions, good for the heart.
Good for the heart, yes.
What else?
Pomegranate is a powerful antioxidant.
Okay.
And some animal studies have suggested that it may be beneficial against atherosclerosis.
So that's the buildup of plaque in the arteries.
That's right.
But, animal studies don't always translate to humans.
Not always.
But there have been some human studies.
There have been some human studies that have shown that pomegranate can reduce arterial damage. And there was a 3-year study that showed that pomegranate juice actually reduced narrowing in the carotid arteries.
Wow, so there's some promising research there.
There is.
Chelation therapy?
Yeah, this is a little bit more controversial.
Okay.
But there is some early data suggesting that it may be beneficial for reversing heart artery disease.
Okay.
And the chapter mentions a 2013 study called the Trial to Assess Chelation Therapy, or TACT.
Okay.
And this study showed that intravenous EDTA chelation improved outcomes after a heart attack,
Okay.
particularly in patients with diabetes.
Wow, so that's pretty significant.
It is.
And then it also mentions that there's some research on an oral supplement with EDTA.
That has shown some promise in reducing coronary artery calcification.
Interesting.
It is.
So there are a lot of different options out there.
There are.
And then the chapter gets into these really exciting...
Promising nutraceutical therapy.
So the first one is nattokinase, and this is an enzyme derived from fermented soybeans. And there was a Chinese study that showed that nattokinase
Reduced carotid plaque volume by 37% over 26 weeks.
Wow.
And the results were comparable to those of simvastatin.
Which is a statin drug. That's really impressive.
It is.
Bergamot citrus. And this is a fruit that's grown in southern Italy, and it's been shown to decrease CIMT, carotid intima media thickness. And this is a measurement of how old your carotid arteries are.
And a decrease in CIMT means that your arteries are more youthful. And the study showed that after 6 months of taking bergamot citrus, there was a significant decrease in CIMT, specifically tocotrienols, a form of vitamin E that are derived from palm plants.
Okay.
And in one study, a vitamin E preparation led to plaque regression in 7 out of 25 patients with carotid disease over 18 months.
Wow.
And there was no regression in the control group.
So that's a pretty significant finding.
It is.
And then it also talks about a combination of pycnogenol, which is an extract from French maritime pine bark, and Centella asiatica.
also known as gotu-kola. And this combination has been shown to promote the reversal of carotid atherosclerosis,
Wow.
reduce angina episodes and heart attacks,
Wow.
and even lower heart artery calcification.
So this is a really powerful combination.
It is.
And then it talks about green algae extract. And this is something that's still being researched.
It is. It's an ongoing study in China, but the preliminary findings suggest that it can significantly decrease carotid plaque by 50% or more.
Wow. That's incredible.
It is.
So all of this information is really, it's very hopeful, I think.
It is. It's very hopeful.
It's empowering, because it's like we don't have to just sit back and accept heart disease as our fate.
That's right.
There are things that we can do. And the chapter ends with this, this call to action, really, to adopt a lifestyle plan for young arteries, a lifelong commitment.
To a healthy lifestyle.
And this is something that we talk about all the time on this show, that your health is not just about what you do today or tomorrow.
It's about what you do consistently over time.
It's about building those healthy habits. And it's never too late to start, right?
Right. Even if you have some damage, you can still improve your health.
So no more excuses. We have the power to change our destiny.
Exactly. The chapter even says the addition of advanced testing, medications, and supplements can lower the risk of aging arteries by 85% or more.
85%. That's huge. So what are the key takeaways?
Don't smoke, walk, exercise every day. Keep your waistline in check. Eat lots of fruits and vegetables. Get enough sleep. And limit alcohol.
Simple, but not always easy.
True, but it's worth it. And remember Dean's story?
Yeah, the hockey player.
It's a reminder that this is serious stuff. But the good news is we have the knowledge and the tools to prevent it.
This chapter is like a roadmap to a healthier heart.
It really is. And it all starts with taking action. Don't wait until it's too late.
I couldn't agree more.
So that was Chapter 5, Strengthening Your Heart. I highly recommend you check out the whole book, The 21st Century Man.
It's packed with even more insights and actionable advice.
And join us next time as we dive into Chapter 6, Reducing Your Risk of Heart Disease.
Can't wait to see what we uncover next.
Until then, stay healthy, everyone.